The truth is we probably haven't seen a virus like this particular one since about 1918 when the Spanish flu went through.
As World War I came to a close, another deadly force was taking hold. The Spanish flu.
We think of it as the Spanish flu because they were the whistleblowers, but it wasn't their fault.
As wartime countries kept quiet on the spread of the flu, neutral Spain reported official numbers, leading to the moniker the Spanish flu. But it's actually thought the virus originated in France, or after American troops joined the war effort.
It was perhaps in those training camps, particularly in farming areas, where the flu may be crossed from animals into humans and then spread as those troops moved across to Europe.
1/3 of the world's population, about 500 million people, were infected with this new strain of influenza, leaving between 50 million to 100 million people dead across the world, and about 15,000 dead here in Australia.
The community response to the Spanish flu, major crisis, so many social services breaking down, was at a very individual level. There were no treatments that really worked once you'd caught the flu. You just had to look after people.
Just like today, quarantine measures were stepped up in Australia.
Although we didn't know a huge amount about pneumonic influenza, we did understand it was spread as a respiratory disease, and basically breathing in things that people had coughed or sneezed out.
Australia's response was strict. Vessels were intercepted offshore and quarantined. Australian states shut their borders.
Churches, billiard halls, picture theatres, live theatre, race meetings, agricultural shows, schools, all of these sorts of gathering places were ruled out of bounds, at least in most of the Australian states. That was the one measure they felt had reduced the spread.
About 1/3 of Australians would eventually get the Spanish influenza, and it's thought it hit Indigenous communities 10 to 20 times harder than the general population.
The virus itself, what we now know was the H1N1 version of influenza A virus, moved out of people and went into animals, and versions of that virus were still being found in pigs well into the 1950s.
It might seem much harder to control the spread of a virus these days, but what can we learn from the past?
It comes down to how we behave, how we feel about our responsibility to the community, and what we can do to help each other when people are in these dire straits.